This is Gina from RN2 Professors with a video for you from my Fundamentals series on the nursing process. These review questions focus on the assessment phase of the nursing process. In this video, I'm going to review questions from the assessment phase of the nursing process. These questions focus on the different aspects of the assessment phase, how data is collected, and types of data. I will show you how to determine what the question is asking and how to get the correct answer. Let's take a look at the first question. Which nursing actions are examples of the assessment step of the nursing process? Select all that apply. Number 1. Administering pain medications for a headache. Number 2. Taking the client's blood pressure after ambulating in the hallway. Number 3. Obtaining laboratory results performed in the emergency department. Number 4. Taking the client's apical pulse when the radial pulse obtained is irregular. Number 5. Determining if a client tolerated the change from a soft diet to a regular diet. This is an application question. The question is asking for you to determine which of the answers are part of the assessment process. This is also a select all that applies question, so you want to look at each answer individually to see if it fits the question. Number 1. Administering pain medication for a headache. Completing a nursing action is part of the implementation phase of the nursing process, so this is not one of our answers. Number 2. Taking the client's blood pressure after ambulating in the hallway. Assessing a patient's blood pressure after ambulation is part of the evaluation phase because you are determining how an action affected the patient, so this is not one of our answers. Number 3. Obtaining laboratory results performed in the emergency department. Reviewing the results from labs, consultations, or diagnostic tests is part of the assessment phase of the nursing process. This is one of our answers. Number 4. Taking the client's apical pulse when the radial pulse obtained is irregular. Verifying data that you collected to ensure it is valid and accurate is also part of the assessment phase of the nursing process. This is also one of our answers. Number 5. Determining if a client tolerated the change from a soft diet to a regular diet. Evaluating the effect of an intervention on a client is part of the evaluation phase of the nursing process. This is not one of our answers. The correct answers to our question are number 3 and number 4. These answers are both parts of the assessment phase of the nursing process. Let's take a look at our next question. The client says, I asked to go to the hospital because I am seeing double and everything is very blurry. Which kind of data is the client describing? Number 1, objective data. Number 2, subjective data. Number 3, tertiary source of data. Or number 4, secondary source of data. This is an analysis question. The question is asking you to determine what type of data is being given to you in the question stem. Here's an NCLEX tip for this question. There are opposites in the answer options for this question. Pay close attention to those because usually one will be the correct answer. Number 1, objective data. Objective data is observable, measurable, or verifiable. The patient's statement about double vision is a sensation only he can experience. So this is not our answer. Number 2, subjective data. Subjective data is based on the feelings and experiences of the patient. You cannot get that information any other way besides what you have been told. Only the patient can experience these visual disorders. This looks like our correct answer, but let's review the rest to make sure. Number 3, tertiary source of data. Tertiary sources are publications that summarize and give background on a topic. These include textbooks, procedure manuals, and medical or nursing journals. So this is not the correct answer. Number 4, a secondary source of data. Secondary source of data comes from someone other than the patient, usually a significant other or another healthcare provider, that gives us supplementary information about the patient. So this is also not our answer. Number 2 is our answer. The patient is giving us subjective data about his vision. Here's our next question. A nurse is collecting a health history from a client newly admitted to the hospital. Which action associated with the data collection step of the nursing process is most important? Number 1, explaining to the patient's spouse that the client's input is more significant than the spouse's input. Number 2, communicating subjective data using the client's words. Number 3, using only non-directive interview techniques. Number 4, collecting primary objective data. This is an application question. The word most in this question stem makes it a priority question as well. The question is asking what is the most important action that the nurse can do while taking a health history. Number 1, explaining to the client's spouse that the client's input is more significant than the spouse's input. The patient is the primary source of information during a health history, but this is an inappropriate statement to make to a family member. Secondary subjective data from a patient's family or friend can be very valuable. Number 2, communicating subjective data using the client's words. Subjective data given by the patient should be communicated in the same words that the patient used. This is to avoid unintentionally changing the meaning of what the patient said. Stating back to the patient what they said is part of the assessment process. This looks like it's our answer, but let's check the other options to make sure. Number 3, using only non-directive interviewing techniques. A nurse usually uses a combination of communication techniques while getting a health history. Also notice that this option has an absolute in it, the word only. Absolutes tend to make the answers wrong. Number 4, collecting primary objective data. Collecting subjective and objective data during a health history is important to get the full understanding of a patient. Number 2 is our answer. It is the priority action for the nurse to take while doing healthcare history. Here's our next question. A nurse is assessing a client. Which information collected by the nurse reflects subjective information? Select all that applies. Number 1, clammy skin. Number 2, agitated behavior. Number 3, shortness of breath. Number 4, numbness of the feet. Number 5, coughing after a deep breath. And number 6, feeling overwhelmed by a new diagnosis. This is an application question. The question is asking you to determine which of the options are considered subjective data. This is also a select all that applies question, so remember to look at each answer individually to decide if it fits the question. Number 1, clammy skin. This is objective data because it can be verified by someone other than the patient. Number 2, agitated behavior. This is also objective data because it can be observed and verified by someone other than the patient. Number 3, shortness of breath. This is a feeling of not being able to catch one's breath. It is a feeling that cannot be measured and only described by the patient. That makes this subjective data and one of our answers. Number 4, numbness of the feet. This is a feeling that can only be experienced and described by the patient. Data that can only be identified by the patient is subjective, so this is also one of our answers. Number 5, coughing after a deep breath. This is observable, so this is objective data. Number 6, feeling overwhelmed by a new diagnosis. Feelings, attitudes, beliefs, and values are all subjective data because they can only be described by the patient. So this also is one of our answers. Number 3, number 4, and number 6 are our answers. They're the only options that are subjective data. Here's our last question. A nurse is caring for several clients. Which action reflects the assessment step of the nursing process? Number 1, taking the client's apical pulse rate every 2 hours after the client is admitted for an episode of pain. Number 2, scheduling a client's fluid intake over 12 hours when the client has a fluid restriction. Number 3, examining a client for injury after a fall in the bathroom. Number 4, obtaining a client's respiratory rate after a nebulizer treatment. This is an analysis question. The question is asking which of the following options is an action done during the assessment phase of the nursing process. Number 1, taking the client's apical pulse rate every 2 hours after the client is admitted for an episode of pain. This is a nursing intervention that happens during the implementation phase of the nursing process, so this is not our answer. Number 2, scheduling a client's fluid intake over 12 hours when the client has a fluid restriction. This is an example of the planning phase of the nursing process. So again, not our correct answer. Number 3, examining a client for injury after a fall in the bathroom. This is an initial assessment of a patient after an incident. This is part of the assessment phase of the nursing process. This looks like it's our answer, but let's check our final option to make sure. Number 4, obtaining a client's respiratory rate after a nebulizer treatment. Assessing a patient after a treatment is part of the evaluation phase of the nursing process, so this is not the correct answer. Number 3 is our answer. It is the only action that is being done during the assessment phase of the nursing process. If you like this video, please subscribe for free and click the bell to get notified when new weekly videos are released. Thank you for joining me.